Welcome to the Mindful Return podcast. I'm Kelly Tuttle, a retired neurology nurse practitioner and brain injury survivor. Together, we'll explore practical tools and real stories to help you rebuild focus, confidence, and a meaningful life after a brain injury. Hey, welcome to the Mindful Return podcast. I'm glad that you're here today. I'm going to be talking during this episode about different brain types. And the reason why I want to kind of go through a list of them is because I want people to know that that they're in the right place. I want to make you more welcomed. Brain injuries can happen in different ways, but it doesn't really matter because we all kind of share similar symptoms and frustrations. And I think that in spaces like this, we can learn from each other. And I'd like to kind of just get rid of those barriers and boxes and pull people out of the boxes of, oh, this is a traumatic brain injury or this is a stroke, and instead put them all together where we can create a bigger community of resources. So I'll be reading from a list because there's quite a bit of different ones, but it's also what I'm discussing won't be exhaustive either. But usually when people think of brain injuries, they think of like traumatic brain injuries. So injuries from an external force. So let's talk about those types of brain injuries. So a traumatic brain injury can be from a blow to the head, face, or body. So it doesn't have to necessarily just be the head. Had to explain to one of my patients when she fell in a parking lot and she struck the front of her face on one of those concrete barriers that she was at risk of having a brain injury, that probably most likely was having symptoms from brain injury. And she argued, no, I didn't hit my head, I hit my face. And I said, no, the face is connected to the head. So it can definitely happen with blow to the face. It can happen with whiplash, and it can happen to a strike to the body. So some common mechanisms of traumatic brain injury are from falls, motor vehicle accidents, collisions in sports, blast explosions, and from military service. And that could be even a blast explosion, even if you're inside a tank. So the blast explosion is a wave of energy going through the atmosphere that strikes the tank, but it penetrates, from what I understand, the inside of the tank, and it reverberates inside that tank, that wave, and then it penetrates the skull and it reverberates inside the skull, and that's where you get your brain damage. And you can also get a traumatic brain injury during a fight or an assault. A lot of traumatic brain injury survivors are domestic abuse survivors, police officers, and people who are incarcerated. They have a high percentage of people with a history of traumatic brain injuries. And then there are what are known as focal injuries, and these can be from penetrating objects into the skull and the brain. Skull fractures. So if you have a skull fracture, you can have focal injury to the brain. Brain surgery can cause focal injuries. In fact, deep brain stimulators for Parkinson's often affect and worsen cognitive function in patients that receive that device. So you really have to have a really good cognitive pool before you have that surgery so that the effects are minimized. And then there what are known as brain contusions. So this is, or it's also known as a cerebral contusion. And you'll hear this also described as a brain bruise. So that's kind of a focal injury. Then you have the diffuse widespread injury, which occurs across large areas of the brain and causes, you'll see this with concussions and diffuse axon shearing. And that's when, if you think of the neuron, the brain cell, as I think they look like trees. So they have roots going down the bottom, it branches at the top. The axon is those roots and branches. And then with traumatic brain injury, there is a primary injury. So when the initial damage is done, but there's also a secondary injury which occurs after the primary injury, and that's brain cell damage caused by swelling of the brain, bleeding in the brain, decreased blood flow to the brain, and this can cause problems with the brain cells. And I've even read some research that the immune response from a brain injury can be seen even up to 17 years after a brain injury. So people telling you to get over your brain injury, that's not cool. That's not cool. And then let's talk about the non-traumatic brain injuries. And so these are, for example, strokes. So a stroke could be ischemic stroke where a clot forms in a blood vessel and prevents blood and oxygen nutrients to brain cells downstream, and that results in those cells dying. And then there's hemorrhagic strokes, and that's when the blood vessel ruptures and blood leaks into the brain tissue and causes brain damage that way. There other non-traumatic events are infections such as meningitis, encephalitis, like encephalitis from West Nile's disease. I did have a patient that had cognitive issues after a West Nile's encephalitis infection. COVID-19, repeated COVID-19 infections leads to neuroinflammation, which can cause brain cells and we've seen evidence of brain atrophy after COVID infections and loss of IQ points. Brain tumors, whether they're benign or cancerous, they cause brain damage because they put pressure on adjacent cells, brain cells. And the other thing too is the treatment for cancers is chemotherapy. Chemotherapy can affect the cognitive functioning of the brain, which usually resolves within a year or two after treatment. But it can make planning and word finding and memory difficult while you're on that medication. Radiation treatment and immunotherapy can also cause difficulty with cognitive function. Other things that can affect cognitive function are brain diseases such as Parkinson's disease and multiple sclerosis, because in these diseases, Parkinson's disease, brain cells die. And in MS, the autoimmune system attacks the myelin neurons extensions. And the myelin is what creates like a super fast communication between brain cells. When that's gone, then that function is slowed down, or the cell eventually dies and leaves scar tissue in the brain. And anytime the brain has to use like a different way of communicating with each cell, this is an inefficient way for it to run, and it doesn't like to run inefficiently. The brain likes to use minimal energy to get the most done. And whenever there are roadblocks where cells have died or highways are not as efficient, then the person will experience things like neurofatigue and then slow brain processing. Another non-traumatic event would be hypoxia, with people surviving drownings and cardiac arrest. And then there are neurotoxins that can cause brain damage and cell death, inflammation, such as lead exposure, mercury, carbon monoxide poisoning. Substances can cause brain cell damage, such as alcohol, amphetamines, opioids, inhalants, and cocaine. And some pesticides and industrial cleaning solvents can cause brain damage if the levels are toxic enough. So I just wanted to touch on those subjects because when I would see some of my patients and they would say they had brain surgery or they had an infection, cardiac arrest, they didn't realize that caused brain damage and that they had a brain injury. And that's where a lot of their symptoms were coming from. I really appreciated the ability to enlighten them about that, to help them make sense of what they're going through. And I hope that this podcast information helps you feel more comfortable in understanding your symptoms. The thing about brain injuries is that the way your brain reacts to it and how it recovers will be different as your personality. So your recovery will not be like the next person who had a similar brain injury, and your symptoms may not be similar. It could be totally different than someone who had a similar brain injury. So it just really depends on the individual and their brain and their brain's response to the injury. So I just would like you to know that you are all welcome here and that you're not alone. And there is hope of getting better. Take care, get better, get stronger. You've been listening to the Mindful Return podcast with me, Kelly Tuttle. Subscribe wherever you listen and head to kellytuttle.org for brain injury recovery tools, free resources, and inspiration to help you return to work with confidence and hope.